Okay, hello, good morning, good afternoon. Welcome to the Winds of Change webinar. We are so excited to have all of you join us today. We're going to go and give it a couple more minutes because I can see here that people are flooding in from meetings that they've just attended. So we're just going to give it a pause for a couple minutes and then we're going to go ahead and get started. But welcome, everybody. Thank you so much for making time for today's very special webinar on the Winds of Change. Okay, perfect. I think we're going to go ahead and get started. First and foremost, I just really want to begin by acknowledging that I am currently located on the traditional, ancestral, and unceded territory of the Anishinaabe Algonquin Nation. It is with utmost respect and humility that I want to acknowledge their stewardship of this land since time immemorial. For those of you who don't know me, my name is Vishal Jain. I am the Director for Cultural Safety and Humility and Environmental Sustainability at Health Standards Organization. We are incredibly honored and privileged to welcome participants not just from across Canada, but across the globe to today's special webinar on the Winds of Change. On September 25th, 2024, Health Standards Organization announced a new ambitious national cultural safety humility initiative called the Winds of Change. The Winds of Change builds on a 10-year journey to create and implement a national standard of Canada for cultural safety and humility. Today's webinar will take us back in time to learn a little bit about the origins of this initiative, and we'll look forward and thinking a little bit about what are the next steps to bring about and implement a national standard of Canada for cultural safety and humility. A few housekeeping notes here. At the bottom of your Zoom screen, you'll be able to select language preferences. Both English and French is available, so everybody should be able to see that at the bottom of their Zoom screen. We are offering simultaneous French interpretation of this discussion, and I just want to acknowledge and thank our wonderful interpreter for being here today and for doing that important work. I've received a lot of questions already, and I want to confirm that a recording of this webinar will be made available. During the session, also, please feel free to use that Q&A function to ask a specific question or make suggestions for future areas that you may wish us to cover as part of this Winds of Change series. There will be a dedicated time in the second half of this webinar to answer a few of the questions from participants. So I encourage everybody to please use that Q&A function, ask questions, make recommendations for conversations and topics that you'd like to see us cover in the future. We'd be very grateful to hear from all of you. After this webinar, we will also be sending an email out to all registrants with a link with a few calls to actions that we'll be discussing here today, including a last call to apply for the technical committee to create this national standard of Canada for cultural safety and humility. So please anticipate an email coming in right after this webinar. Lastly, there will be a short survey at the end of the webinar. If you could please take a moment to fill it out so we can better serve your needs for future events and webinars, we would be very much appreciated. Now, without further ado, it is my pleasure to be able to introduce our incredible panelists here today. And I know that the more I say, the more embarrassed they will be, but we're going to have to get through it because there is a lot to say about these three fantastic panelists. I'll begin with introducing Monica McAldfuff. So I really want to just begin by noting that Monica is from Secwepemc First Nation. She also serves as the Vice President for Quality, Cultural Safety and Humility and the Chief Nursing Officer for the First Nations Health Authority in British Columbia. Monica proudly joined FNHA in January of 2020 as the Executive Director within the Office of the Chief Nursing Officer. Bringing with her over 30 years of healthcare experience, first as a registered psychiatric nurse in Vancouver and the Lower Mainland, and since then progressing into several leadership roles within the healthcare system. So welcome, Monica. Our next presenter panelist is Marilee Nowgesic. Marilee is from Fort Williams First Nation near Thunder Bay, Ontario. She is, of course, the Chief Executive Officer of the Canadian Indigenous Nurses Association. Marilee received her traditional teaching from the recognized Médewian and First Nations elders in her home community. Her formal education was obtained from Lake Hill University and my alma mater, Carleton University. Um, an interesting fact that many of you don't know about Marilee is that she also studied music with the Royal Conservatory of Music. So we're really, really honored to welcome Marilee to the panel as well. And last but certainly not least, Margo Greenwood is an Indigenous scholar of Cree ancestry. Her academic and professional credentials include leadership of the National Collaborating Center for Indigenous Health, Vice President of Indigenous Health for the Northern Health Authority in British Columbia, and Interim Scientific Director of the Canadian Institute for Health Research's Institute of Indigenous Peoples' Health, alongside her professorship with UNBC's education program. Last month, HSO was honored to announce Dr. Greenwood as the co-chair for the National Standard of Canada on Cultural Safety and Humility Technical Committee. So welcome to all three of our panelists here today. And without further ado, I think we're going to go ahead and get started. So I'd like to begin by kind of going into talking a little bit about the role and who is the First Nations Health Authority. It's almost impossible to talk about the winds of change without talking about FNHA. So Monica, I'd love to turn this to you. If you could describe to the participants, those who are in Canada, those who are very familiar with the First Nations Health Authority, those who've never heard of the First Nations Health Authority, what is the mission and the vision of FNHA?
Thank you, Vishal, and very honored and grateful to be part of this panel this morning with Marilee and Margo. So it's so great to be here. I also want to acknowledge I'm calling in today from the traditional unceded territories of the Musqueam, Squamish, and Tsleil-Waututh, where I've been grateful to work and be a guest on these lands and live as well. So grateful to be on this panel and happy to answer those questions, Vishal. What is FNHA and what is it all about? So for those that don't know, the First Nations Health Authority actually has been 11 years in service, but many years in the making. It's the first provincial First Nations Health Authority in Canada, where we serve all of the First Nations people in the province of British Columbia. So we were very fortunate to come with agreements with our provincial and federal partners to support the healthcare needs of the First Nations. And we actually hear from the people, and we make sure that we take our directions from community to do their good work. And we also recognize that every community and nation is different. So the way we're organized is actually by our sort of nations and how they've set it up. Our vision is healthy, self-determining, and vibrant BC First Nations children's, families, and communities. And our mandate is really to serve First Nations in the province. And so we really design, manage, deliver the programs. We work with health authorities and other health service agencies to make sure we can deliver on our vision and our mandate. And obviously we collaborate with the Ministry of Health as well. And so to me, it's been really exciting to be part of this organization because we are really driven by our communities. It really is community driven, nation based, and that's where we get our direction from. And so it's really been exciting to be part of the First Nations Health Authority.
Thanks, Monica. And many people don't know that the conversation about a cultural safety and humility standard began in 2017 with the First Nations Health Authority approaching Health Standards Organization and asking a pretty interesting question. What would it be like to blend what FNHA does so well in terms of provincial leadership for cultural safety and humility with what HSO does so well in terms of developing standards? What would it be like to bring these two worlds together? And of course, it took about 4 to 5 years, and I think one global pandemic in the mix. But in 2022, the First Nations Health Authority and Health Standards Organization published not just a provincial first or a national first, but really a global first, a Indigenous-led cultural safety and humility standard for the province of British Columbia. For those who are unaware of what this BC Cultural Safety and Humility Standard really entails, Monica, I'm wondering if you could tell the audience here a little bit about what the major takeaways are from that standard, and what was it exactly that the technical committee that was assembled to create that standard, what were they trying to achieve through the creation of it?
Thanks, Michelle. I think I really like your comments around sort of the vision of FNHA really wanting to expand cultural safety and humility across the healthcare system in the province of British Columbia. And I think the sort of biggest takeaway is really cultural safety and humility has always sort of been looked at by many people as a personal journey, which it is around their healthcare practice. But how do we lift that up and actually make it a system process where organizations can actually have some guidance and direction where they can analyze and actually measure how are they doing around culture, safety, and humility. So this standard really has brought together that opportunity for organizations to really look at where are they measuring up around culture, safety, and humility. So it's been situated in really 8 different domains where people and within the organizations can really look at how they are doing. So when Indigenous people come into their health organization, that they feel safe, that they get the good health outcomes that they deserve. And then it also is that guidance for people to make sure that if there's questions or people are wondering how do they even begin addressing culture, safety, and humility, that standard is there in place for them. And I think it's been excellent, great, exciting work that I've been very proud to be part of, because I think and this is why it's so exciting that we're working on the Canadian national standard, but it really is the first of its kind where people have something concrete that they can use as a guide and move their organization forward to ensure the culture safety is in place for Indigenous people.
Thanks, Monica. And I think it's probably worth noting, and I'm wondering if you may be able to comment on this, that upon publication of the standard, it was endorsed by the First Nations Health Council, the First Nations Health Directors Association, and through very much the championing of FNHA in 2023, it received an endorsement from the Special Chiefs Assembly at the Assembly of First Nation. I'm wondering, Monica, if I could ask you to just comment on why that was an important step in the process to bring about the BC Cultural Safety and Humility Standard.
Thank you, Vishal. And what I didn't mention earlier, and I probably should have, with First Nations Health Authority, we actually have a pillared approach with our organization where we do have our Health Directors Association, which is really sort of our technical expertise made up of different health leaders in the health system of the province. And then we also have our Health Council, which is really our advocacy and our political scope of the way we've been set up with our governance. And so we all come together to really uphold the work of the First Nations Health Authority and hear from our people. So we all move together as one body. And so to have their endorsement would be critical, because we wouldn't have been able to move forward without this standard, without that endorsement of our governing partnerships.
Yeah, fantastic. Thanks, Monica. And so I think the thing that people are really keen to learn about is implementation of the standard. So 2022, the standard is published. That's just over 2 years ago now. And I know there's been a tremendous interest to understand how we take a standard, which is an incredibly rich collection of criteria and of guidelines and of thought leadership, but how do we take that kind of off the page and breathe life into it through that implementation process? So Monica, 2 years since that publication date, I'm wondering if you can take the audience through what implementation has looked like since that publication date.
Thank you. I'm gonna have to look at some of my notes because there's been an incredible amount of work that has happened since then that I'm really happy to share about. So as you mentioned, the standard was published in 2022, and FNHA conducted an extensive self-assessment process against the standard. The findings from the self-assessment were shared with our senior executive team with recommendations and consideration. We also will be publishing our self-assessment methodology, which includes a novel maturity assessment and a continuum model as well. So in 2023, FNHA re-partnered with HSO and Accreditation Canada to prepare and test the standard for implementation with healthcare organizations across BC. We first co-chaired a working group with HSO to explore how we can assess the standard in a culturally safe and appropriate way. The working group included representations from First Nations community health organizations, Métis Nation BC, Indigenous healthcare providers, and Indigenous patient partners, which of course are very important. We co-created implementation knowledge mobilization tools, including fact sheets and a short documentary, pocketbooks, and recorded webinars as well. We user tested the standard with 11 BC health and social service organizations, ranging in size and service delivery models. Also, FNHA and Accreditation Canada co-authored a What We Heard report, which was outlining the findings of user testing, which was presented to BC Health and Social Service organizations. We've also been active in creating and facilitating platforms for increased collaboration and knowledge sharing as well. In 2023, we received funding support from Healthcare Excellence Canada to co-chair a BC community of practice with Métis Nation BC. This was focused on implementing the standard, and the community of practice is attended by a range of partners, including regional health authorities, the Provincial Health Services Authority, Health Quality BC, the provincial government, Accreditation Canada, among others. We've also held conference workshops at Quality Forum in 2023 and 24, and held workshops with HSO and MMBC at the Canadian College of Health Leaders National Conference in 2024. And really, it's been an incredible, busy journey, but there's been so much good work done if we're actually going to implement and move the standard along. So earlier this year, FNHA, alongside with Métis Nation and HSO, co-hosted a multi-day in-person symposium to bring together health system partners across Canada to explore leading practices to implement the standard. And then in 2025, good news coming up, we will continue our longstanding collaboration with HSO and Accreditation Canada to support the recruitment of a new subspecialty of cultural safety and humility surveyors. We will then proceed to work together to pilot the first cultural safety and humility assessment in Canada. So it's really been exciting. And then lastly, I'm just going to end that the BC provincial government has stated their intent to implement the BC Cultural Safety and Humility Standard. And they actually had it in their health service plan, which was published in 2024 for the mandate for the health authorities. So it's been really exciting, good work to have so much partnership and people supporting the implementation of this culture, safety, and humility standard. And of course, the backing of the provincial government as well, the Ministry of Health.
Thanks, Margo. I mean, it's an incredible amount of work, and kudos to the First Nations Health Authority for that partnership and the relationship building. And maybe as a final question before I move on here, is why was it so important for FNHA? It's so clear from everything that you've listed in terms of implementation that convening and collaboration and relationships was really at the heart of it. The platforms that have been created, taking this to conferences, hosting multi-day symposiums. It's so important that it's being done together in collaboration. Can you just speak about the role of relationship and convening and collaboration as part of implementing standards, or really as part of the FNHA ethic, doing it together side by side?
Well, I think for First Nations Health Authority, which we had talked about earlier, really our foundation is around culture, safety, and humility, and really changing the system that we work in. And we have some control over some of our program services, but really the healthcare system goes across many different organizations, many disciplines. And if we're going to change how racism is impacting our people today, we need to do it with good allies in the system. And so it really starts with individuals, but it starts with organizations. And we need to partner and do this in a good way and role model across the health system how we can really leverage the good work that other people want to bring forward. And there's been many great allies and champions who have been moving the dial on Indigenous specific racism. And we really want to leverage that and partner in a good way, because we can't do this alone. And we want to just really make sure that we create the space and the opportunity for the strengths that other people can bring forward.
Fantastic. Thank you, Monica. And honestly, I cannot think of a better segue to introduce our next panelist. Marilee, you heard from Monica the importance of relationship building and working together in true partnership. Before we kind of get into all of that, I'm wondering, Marilee, if it's fair for me to ask you to provide just a little bit of an overview about who are the Canadian Indigenous Nurses Association.
Thanks a lot, Michelle. I think the bigger importance here is the fact that you've got 3 M's on the panel. Now that says something right there.
It was part of the criteria for
that,
recruitment.
that says everything right there. So thanks everyone, and I want to acknowledge everyone that's online with us today, and thank you for taking the time from wherever you are in the country. I want to recognize my ancestors and your ancestors, and especially to our non-Indigenous participants who are part of this call today, recognizing your ancestors who have brought you to be part of this table and this discussion with us. The Canadian Indigenous Nurses Association is approaching 50 years. It is the longest standing Indigenous health organization in the country. We are the advocacy, the voice for First Nations, Inuit, and Métis nurses across the country. The safest data that we have at this point would come from a survey that we had done back in 2018, 2019 with the University of Saskatchewan, where we were able to capture the number of registered nurses. Well, there was a large nursing category across the country and to their respective identities, First Nations, Inuit, and Métis. However, since that time has changed, there has been many differences in regards to identifiers and how we're going to look at how we measure our members in CINA. CINA is also a organization that looks after policy, education, research, and we are, and like I said, advocacy. We are not a service delivery entity, but we are an organization that looks at how we are going to address the past histories, the current trends, and the foreseeable future of what it is that we're going to be able to do within our healthcare systems in Canada. When I say that our future, I'm looking at, and you're going to go, did she actually say that? Yes, a 500-year work plan. We are looking at how we're going to write that with many of our partners like Monica and Margo at the table. We're writing a work plan that will lay down the path for our youth. It is a succession plan for how we're going to look at our collaboration, partnership, and our stakeholder engagement with mainstream organizations, not only in Canada, but around the world. We are also an organization that looks after how we are going to look at various portfolios that are on the table. But I must say the one that, allows me to really have some, I guess, a pride here is how we are able to utilize the current environment of the governance situation and looking at moving forward the needle on, and I guess, Michelle, this goes into your next question. It moves the needle on why is it we wanted to partner with HSO. And that really is because in our current system in Canada, we are trying to do the reconciliation exercise with our mainstream partners. And in order to move that needle, it's imperative that mainstream organizations realize their role and responsibility in meeting the Truth and Reconciliation Commission's calls to action. I don't mean do all 94 of them, but let's move the needle. We're approaching 10 years and very little has been done. There are champions that are prepared to go out with their report card, but at CINA, under the healthcare portfolio, we would rather see us working with organizations whom would want to be able to go to your public domain, showcase what it is that you've been doing, how you have met some of the calls to actions, and how you will be addressing them as the years go on. It's not a one-time activity. It is in perpetuity. It took us a long time to get to the truth. Reconciliation will take longer. I think that we're in a great position right now to be able to do that. Now that we are, sorry, now that we are seeing what that engagement with our stakeholders actually means. At CINA, we have established multiple, and I'm talking double digits, partnerships with organizations that are saying, I don't know how this is done. I would like to be respectful of the people and be careful on that which I don't know about. And that is a true act of humility. And for that, I say to those organizations, you've met the first requirement. You said, I don't know. Let's open that doorway. Let's look at what cultural safety means to you. And when I open up that doorway under the Indigenous nursing knowledge umbrella, I'm very careful because people are starting to get confused. They hear cultural safety, they hear cultural safety and humility, then they hear cultural competence, then they hear cultural knowledge, and it goes on and on and on. So I want to try to make sure that when we're unfolding that songbook, that we're actually saying to the people, hang on a second, your part in the song hasn't yet started. We're going to, practice the rhythm with you. One of the things that we also encourage when we're doing our collaborations with our external stakeholders is looking at being very careful on how we also preserve our traditional knowledge. And that is something that both myself and with the support of my executive have embarked to the World Indigenous Intellectual Property Organization in Switzerland and have said, I need to look at Western medicine is doing this. We license our nurses under this, but I need to look at how we incorporate traditional knowledge, how we incorporate the blending of that knowledge into our practices and our approaches when we don't have all the bells and whistles in our communities, when we don't have access to resources, and we don't even have enough in the workforce. So it is with that that I honor and respect all of those whom are nurses and or in the healthcare profession across the country. Yours is a well-deserved honor and privilege that I'm standing behind. With that, we will also want to be able to look at when we do those types of engagements, it's how to liaise that call to action with an Indigenous partner. And then so that way we can report to the United Nations Declaration on the Rights of Indigenous People and to the national Indigenous leadership tables, saying, here are the organizations, here's what they've done, here's what they've tapped into, here's where they are going. We have gone through what it is, the protocols. We have also said, yellow light, don't be offended if there are certain segments that you cannot be participating in. That is for your protection and ours. And finally, when we look at the health portfolios, it's how we're going to be able to respect the mandates of the tables that are coming to us, saying, we need your help. Here's what we want to do. Here's the problems that we're facing. We're not sure how to embark upon this, that, or the other thing. And for the most part, it's not just the health segment within the TRC's calls to action. There are other segments within those TRC's calls to action, for example, education, employment. Number 57, training and skills development. Number 62, and I could go on and on and on. So as you can see, I've become very enthusiastic about what the TRC can actually do in moving our organizations forward.
Thanks, Marilee. I really appreciate that. And, acknowledging the 50 years of championing the voice of Indigenous nurses, policy, education, research, advocacy. I mean, it's an incredible legacy and it will continue on. Out of those 50 years, a year and a half of them were dedicated to working with HSO to scope the idea of a national standard of Canada for cultural safety and humility. We heard from Monica, the BC Cultural Safety and Humility Standard published in 2022. The question about will there be a national standard, I think loomed quite large. I'm wondering, Marilee, if you could take us through that 18-month national dialogue that that CINA really kind of co-led with HSO. But what would you say are their major takeaways? I know you've already spoken about the significance of the TRC calls to action, the United Nations Declaration on the Rights of Indigenous Peoples, the role and significance of traditional knowledge. But I'm wondering if there were any other key insights from your perspective that you heard over that 18-month period that was really focused on that national dialogue about a national cultural safety and humility standard.
Gee, I would love to tell everybody what we did in 18 months, and it would take me 18 hours, but I'll try to do it in 18 seconds. So with that in mind, what we heard when we decided to embark on this partnership with HSO AC is looking at really, this is a first opportunity to open up this envelope for this type of an activity or an endeavor. We saw it as a, wow, this is it. This is really going to help move the needle in the health portfolio and how we're going to be able to address some of the changes that are required. When we saw that, we also saw the gateway to us engaging with community, Indigenous-led opportunities and activities that allowed us to hear from the people whom are dealing with the lived experiences on these on a day-to-day. And from those, we did a series of surveys from coast to coast, not the third coast, unfortunately, but we will get there. And looking at what is the importance, what is the benefit, and what do you see as an outcome? And we heard very loudly, and with the people having the confidence that they do in CINA, said, nurses are the pivotal point of our communities. If an Indigenous-led nursing organization like CINA can take us forward and help us measure those activities and collect the qualitative data that, you know, designs part of this framework for us, then let's do it. It's to our benefit. We're now looking at data collection. We're now looking at health governance. We're now looking at legislation that impacts our people and could change how that unfolds in the healthcare environment. With that, when we saw the opportunity to work with HSO on this, there was really no time to, you know, sit back and think about it. It was just, let's do it. It's a great time. Let's go forward with it. They had all the tools. We have all the expertise. Let's go into the, you know, let's go into the kitchen and let's really do something great here. And we did that. When we did those activities, we made sure that we also encountered not only one specific group, but we tried to look at groups that would have a blending of First Nations, Inuit, and Métis people. So making our presence known and really seeking out these people, and you know, in my very delicate way, for those of you who know me, looking at engaging those people and bringing forward their voices to saying, what is it that you want or you see or you look at the benefit of this? And are you able to express that in the language of your choice back at your community level? Is it too technical for the translation to be taken into your dialect and throughout your region? So that's really the importance of the 18. More than 18 seconds, sorry.
No, you did fantastic. Thank you, Marilee. I appreciate that. So I guess, Margo, this takes me really to you. We've heard from Monica, the BC Cultural Safety and Humility Standard, and the incredible work that happened in that province. We've heard from Marilee in terms of asking the question nationally, should there be a national standard of Canada for cultural safety and humility? And then, of course, on September 25th, 2024, HSO formally announces the intent to create an Indigenous-led national standard of Canada for cultural safety and humility. A week after that, we announced with an incredible amount of pride that you will be serving as a co-chair for the technical committee to create that standard. I'm wondering if you can just take us inside your decision to join that technical committee as a co-chair. What were your thoughts and what were you kind of thinking as you heard about the winds of change and the work that was happening in BC and with CINA?
Thank you. Thank you for the question, and thank you to everybody on the this webinar for taking the time to be with us. I know how busy you all are. I also want to acknowledge the ancestors and lands of the Anishinaabe and Algonquin peoples and thank them for allowing me to work and live on their lands. Vishal, thanks for this question. I'm not sure that you want to get in my head and roll around there. It's a bit scary. But I was really excited to hear the work, the follow-up work to the FNHA's BC standard by the HSO. And I guess when I thought a lot about this, I thought about it from two perspectives. One was a personal perspective and one from a professional perspective. So I thought about, personally, I'm a strong believer in basic human rights of dignity and respect for all. And that really drives a lot of the work that I do. Cultural standards, in my mind, for Indigenous peoples are a step towards realizing their rights, their fundamental rights. And standards also have the ability to shine a light on the colonial experience of Indigenous peoples and the fundamental inequities that they experience, often on a daily basis. Sad but true. So I believe that this tool and the guidance it can provide to healthcare professionals, policymakers, leadership is extraordinarily important. The second part of my response really reaches back to the work that I've done over the last more than 2 decades. For 23 years, I led the National Collaborating Center for Indigenous Health, and where we worked on making evidence, so health evidence, scientific evidence, if you will, available in a timely way to practitioners, health administrators, and for the public. And I really want to see how we take that evidence, if you will, and I'm going to speak to Indigenous knowledge here in a moment, so don't think I've forgotten that. How do we take that from a knowledge translation perspective and make it real in our actions? So I'm really thinking about practical implementation. I want to see that kind of knowledge and Indigenous knowledges that inform our practice. I want to see how we operationalize that in practice and in policy. And I think we have an opportunity here with this standard to do that, because the standards in my mind give us those guidelines or those to our actions, whatever they might be. And I thought about that relative to my work also in the Health Authority. So I was 8 years a vice president for Northern Health in Northern British Columbia. And we really worked at creating a culture of change in the organization. We really wanted to change the organization's culture, if you will. And we began, and I'm going to get very practical here, very concrete. We began with an overarching action plan around cultural safety and humility. And we began this several years ago. And in that plan, and there were many, many actions and initiatives, but in that plan, each portfolio within the health authority, so for example, in finance, in HR, in clinical practice, in housekeeping, in long-term care, all of the portfolios had to commit to 1 to 3 objectives annually that they would work on that focused on cultural safety and humility. So that it wasn't just a conversation happening at an executive table, but that it was real on the ground, in the system, in components of the system. Of course, we needed to support the system in moving that work. And so some of the things that we did, and I don't have time to talk about everything, but happy to have offline conversations. We created, for example, an educational video that simply began by defining what is cultural safety, because a lot of times people don't know what that is, that we work with. We created a learning series for all employees that had different levels and different modules. We created a policy assessment tool where we went through very specific algorithms to assess policy and how it might impact First Nations, Inuit, and Métis people's lives if we implement. We had a community of practice for Indigenous employees. We paid attention greatly to the In Plain Sight report and the findings. We paid attention to UNDRIP. We paid attention to the report on murdered and missing women, Indigenous women and girls. We paid attention to Truth and Reconciliation, but we paid attention to the communities. We paid attention to the people that we served. And so it was with great happiness that we participated with FNHA on the technical working group from Northern Health in its development. So I'm going to stop there because I really could go on and on. Sorry.
No, thank you, Margo. That's really illuminating, and I appreciate you drawing on your experience as a seasoned healthcare administrator to talk a little bit about the impact of a standard and its role in terms of shining a light. I'm wondering if you can just touch on the intersection of cultural safety and humility and the work that's happening to advance culturally safe care, and then quality and continuous improvement, which I think is so closely associated with accreditation. What's the overlap here between cultural safety and humility and accreditation? Like, how can these two work together to actually support that vision in terms of human rights and dignity and respect and equity?
Well, I'll make a couple of statements. First of all, we know that when we're talking about standards is the foundation upon which we build our practice. And of course, we need to engage with those that we serve first and foremost, in my humble opinion. I think we engage when we're speaking about Indigenous peoples, First Nations, Inuit, and Métis peoples in this country. We're also speaking about diverse knowledge systems. And I use that term to mean all that we are culturally, linguistically, how we are in the world, how we see the world. So how do we bring diverse systems of knowledge, so a Western-based scientific knowledge, together with Indigenous knowledges to create a standard that is going to be respectful of those that we serve? And I think that's a fundamental piece that informs standards. Standards, then, we use accreditation processes to prod along, make sure that we are implementing the standard. So if we say we're going to do this, it's been informed by the people and all of those kinds of things, then we need accreditation processes to check back and say, hey, are we doing this? Is the system doing this? Is a part of the system doing this? Depending on what you want to measure as the system. And I think the quality piece comes in before we even, I know from my own experience, before we got to assessment, we would do the accreditation piece, where we would have the external assessors come and visit our health authority. We would do quality assessments ourselves. We would ask ourselves, are we doing what we said we would do? And if we're not, what do we need to know to do that? What do we need to change? Do we need a policy? Do we need education? Do our practitioners need support? Who needs support? And how do we change that? So once we got to accreditation processes, we pretty much know where we are going to stand. And even after we go through that process, if we still want to improve in a particular area, the assessors can help us to identify those, and then we go back to the quality process. So let's work on these areas. So that's what I know from my own experience around that. But I really think being really clear about what that standard is really fundamental to any system, and the commitment that the system will make to creating that change. And that happens internally. I will say two other short things, and I'm sorry, I'm probably going on here. I think the standard is not a tick box. Accreditation is not a tick box. That doesn't work, and it's not going to work. We can't say one and done, as Marilee said, a 500-year plan. This is a commitment of change, and it's a commitment to do things differently. And I think, to me, that's extraordinarily exciting. For me, I guess in all the work that I've done, this leads me to the place of relationality. I think this standard is embedded in relationship. I think that to make it really work, and when you look at the standard, you're looking at multiple levels within a system. You are looking at the face-to-face relationship that happens between healthcare professionals and those we serve. We're looking at systems and policies that are relational. How will this impact people? And we're looking at structures. How does the structure and the system enable good care? So if we look at those multiple levels, how does it enable those positive relationships? This is not something you measure in a jar. It's
Definitely.
outside of it.
Thanks, Margo.
Go ahead.
I do one final question I have for you, and I'm not sure how complete of an answer you could provide, but I think the thing that a lot of people are asking is, your vision for this national standard. Now, you've already articulated what you think this national standard is going to be like, and it's an essential role of relationality, both between a provider and a patient, at a policy level, at a system level, and at a structural level. But Margo, I'm wondering if you can give us any more of a glimpse into what you believe this national standard of Canada for cultural safety and humility is going to look like, or the principles upon which it will be based on.
Thanks. Thank you, Vishal. I mean, I think we all have dreams, right? And we hope for the best. And I'm going to reach back a bit to the work that I was on the technical committee for the BC standards. So I'm going to reach back there. I think there's some really incredible principles. Ones that I would highlight would be distinctions based. I think that's extraordinarily important. And beyond that, I think we have to really look at the context in which these standards will be implemented. And I always go to the word inclusive. And when I think about inclusivity, I think about including all, but that demands respect for difference, respect for diversity. And how do we show that? And that's really important. And I think alongside of that, which seldom gets talked about, I think, is the concept of flexibility. Because in order to be diverse and respect diversity, we must be flexible in implementation. Now, we don't back off, in my mind, we don't back off what the standard is, but it's not going to look the same in downtown Vancouver as it is in rural northern Manitoba, perhaps. I would guess that. And so how do we have the flexibility to allow those diverse relationships and realities? And I think those are some of the questions that a national group will grapple with. But here's my final statement on this, and I probably should have led with this. It won't be just my vision. It'll be a collective vision. It'll be an inclusive vision of all of us where we can come together and work as a collective because we have a common goal of the optimal health and well-being of First Nations, Inuit, and Métis people across this country. And I would hope that though what we think about may be applied to many, many other peoples, and that our fundamental human rights as humanity are uplifted in this standard.
Thank you so much, Margo. I'm so excited to see how this technical committee comes together and creates a national standard like this. I can see here that we've just got a flood of questions from the participants, all very eager to ask questions of the three M's on this call, Monica, Marilee, and Margo. I'll choose this one here that I think is really fascinating. Margo, Marilee, Monica, you all mentioned kind of the significance and importance of self-reflection, self-assessment, the opportunity to actually look within to be able to begin this work. Many people, I think, are surprised, Monica, to hear that FNHA, the First Nations Health Authority, conducted a self-assessment. They turned the BC Cultural Safety Humility Standard kind of onto themselves to see how they stack up against that standard. I'm wondering, Monica, if you could kind of inspire, I think, some other folks who are wondering if they should be doing a self-assessment. Why did the First Nations Health Authority take on a self-assessment of the BC Cultural Safety and Humility Standard?
Thank you. And I love that question because there's so much I could talk about. But I think this one is really important. And for First Nations Health Authority, if we are to be worldwide leaders in culture, safety, and humility, we need to do our own work. So yes, we were a part of the creation and the leaders for the BC Culture, Safety, and Humility Standard, but where did we measure? We're a newer organization, 13 years in. So we actually had a group of change champions called Sesamaya come together, and it was representations from across the organization that came together through surveys, one-on-one, looking at a review of all our research and policies. We actually did our own thorough self-assessment against the full standard, and we came up with 89 recommendations where we could improve around the culture, safety, and humility standard. We brought that report to our senior executive and our leader, Richard Jock, who we reviewed it as a senior executive team. We endorsed all these recommendations that came forward. We released the report to all the staff so that they could see. And it was really beautiful the way they did the evaluation as well, because they did it on really where we were using the metaphor of a seed and a flower and the meadows. And it was really great to know that all the 89 recommendations were endorsed. They were matched up against all of the executives' annual operating plans, because some of the work was already underway. But where were we? How could they fit in? It was in all of our mandate letters. And so there's quarterly reports that are going to be shared out to all of the staff and obviously the executive, so we can keep working on this. We plan to continue to self-evaluate so that we can make sure that areas that we're really strong in, did we need to do more work? And so I think it was really important that for us to role model across the system, we're not afraid to look at where we're at, and that there's always improvement and opportunity, and that the leadership fully embraced it. And we heard from the staff, the frontline, the people we serve. Like, it was a very thorough assessment, and we put together a toolkit and a paper around our process, because other organizations were very keen and interested how we could really do this. So we role modeled the standard through our process, and it was just, for me, a really great thing to be part of, and really proud of the quality team who led that in partnership with our culture, safety, and humility team. But because it was a standard and accreditation process, it was actually our quality team that led the work versus the culture, safety, and humility team. But they did work closely together. So it was a great opportunity to showcase how you can do it, and the practical application, which Margo kind of talked about a little bit. Like, it's one thing to have a standard, but it's the application and the process to actually make it come to life.
Absolutely. And I'm seeing a few questions here asking, can we learn more about this self-assessment? And I just will note that the First Nations Health Authority did an incredible webinar with the UBC Learning Circle called Planting the Seeds for BC Cultural Safety and Humility Standard Evaluation. I highly recommend everybody go and check out that webinar that was presented as part of the UBC Learning Circle. I wish I can go through so many of these questions, but Marilee, there's one question here that I just would like to hear your thoughts on. So you've heard Margo kind of speak about the role and the importance of accreditation and of assessment. You've heard Monica speak about self-assessment and kind of the, turning the gaze within. Marilee, you used a different term that I think actually bears just a few more minutes of thinking and thought, which is the importance of self-reflection. What do we think, and what would you say, Marilee, to all those who are thinking about looking into this standard, asking themselves the questions that the standard kind of poses, but what's the importance of self-reflection when we're talking about cultural safety and humility?
When we're looking at this from the SENA lens, it's a matter of, I don't like the potluck that's being served, so I'm going to turn all the bowls upside down. That's really what is happening. And what we're seeing is people going, holy man, we didn't think they were going to do that. But at the same time, we're saying this is the time that we needed to be able to do to see what had been done in the past, what we coped with during the pandemic, which allowed a lot of Indigenous healthcare practitioners to think outside the box and look at the resources and the networks that they had within. And then as we came out into a hybrid situation, it then said to everyone, I think we can do this. Now, what is it we want to do, and how do we want to do it, and who do we want to work on while we're doing it? And that in itself gave people the impetus to saying, we got to count what we're doing. We can't just go ahead and do it. We have to say how many people were there, why were they doing that, and then bringing that information over to our, to our basket and saying, Dean is putting this all together. They're going to put together all of these things for us. And what it also lends to is how we are able to, and something that really got to me was what Margo said about flexibility. Our inherent rights are not flexible. We are there for healthcare. And now we're in the 21st century. Now we've got to twist that again just a little bit. That needs some assessment. We need to look at, are we going to have to work in silos again? I mean silos as far as First Nations, Inuit, Métis, or will we look for a way to be able to do our work for our respective citizens and our membership to be able to combine the required healthcare outcomes that are needed to meet the needs of our current day situation. So that kind of assessment, it really said to us, we got to turn the table, and if they get uncomfortable while they're turning the table, I'll pick up your chair and move with it. And let's see how this unfolds together in a very, I think what is going to be new. And that is part of, in the winds of change, people have to get used to change, and people don't like change. So we're going to get used to it together. Thank you.
Thank you, Marilee. And I can't think of a better way to end today's webinar than on that note. First and foremost, I want to thank all three of our panelists for the time, their insights and perspectives, and sharing with us a little bit about the journey that is the winds of change. So thank you very much. I also want to thank all the folks that joined us, again, not just from coast to coast to coast, but really globally. So thank you so much for those. And we really look forward to continuing to come back and presenting on the progress that the technical committee is making to create the national standard of Canada for cultural safety and humility. Just a few closing kind of notes here. That the application portal to join this technical committee closes end of day tomorrow. We are still seeking those who are interested to come join the process, submit an application. You can find that on the HSO Winds of Change website. A link will be sent out to all the registrants. So if you are interested, please submit that application. We are looking currently for individuals to join this technical committee. Anyone who's interested in receiving more information and updates on the Winds of Change can actually go on our Winds of Change project website and submit a contact form, and we'll be submitting biannual newsletters on this initiative. And so you can stay informed that way as well. We are seeing here that there's a couple of questions about whether or not this will be recorded. Absolutely, this entire webinar is being recorded. A link will be sent out to all the registrants. We really encourage you to please share it with those who couldn't be here with us today and are very much interested in the progress that we are making towards the winds of change. And on a closing note, there will be a brief survey that should pop up any moment now. And if I could please ask you to complete the survey and let us know a little bit about your thoughts on this webinar and on future webinars so that we're delivering content that's relatable to you and your practice. So again, thank you so much, Monica, Marilee, Margo, for your time. We look forward, and we're very keenly looking forward to seeing the progress that's going to be made on this national standard of Canada for cultural safety and humility.
Thank you very much. Thanks, my colleagues.
Yes, thank you everyone for joining this wonderful conversation. Thank you.